Hello and welcome to AshaUSA speaker series. It's called Let's Start the Conversation, where we talk to experts in different fields who talk about topics that they're passionate about and that they're working in. And today we are going to talk about neurodiversity. Recently, I read a quote somewhere which said, "We are freshwater fish in salt water. Put us in fresh water and we function just fine. But put us in salt water and we struggle to survive." This is an exact quote by an autistic person, and these words really capture the experience of people whose brains function differently on a day-to-day basis. And today, to shine some light on this particular topic, we have with us pediatric neuropsychologist Dr. Megan HelmEn. Hello, Dr. HelmEn. Welcome.
Hi, thanks so much for having me.
Yeah, let me quickly introduce Dr. HelmEn. She began working with children with developmental disabilities over 20 years ago and heard many disheartening stories from families about how their child was diagnosed. She decided that she wanted to be the person at the start of the process, sharing a diagnosis with parents in a compassionate, informed manner. Dr. HelmEn has over 12 years of postdoctoral experience conducting evaluations with children. In August 2022, she opened her private practice, Developmental Discoveries, to make a clinical process a meaningful experience for children and families. She balances clinical expertise and research-based practice with connection and a sense of humor. So Dr. HelmEn believes in respecting each child as a whole human who can be included in the evaluation process. So thank you so much for being here today. And, let's start by talking about these terms. We hear these terms thrown around a lot these days: neurodiversity, neurodivergence, or neurotypical. So can you tell us what do they actually mean?
Sure. So we talk a lot about diversity in our culture in terms of racial diversity, religious diversity. And when we say neurodiversity, we're talking about variation in how the brain is wired. So differences in how the brain develops from early in life. And we know that some brains develop with certain patterns that change behavior and change kind of their way of processing the world. And certain patterns we have come up with names for in kind of the Western medical lens, and then kind of call those different diagnoses. I have a couple of slides I can share to kind of allow a visual for that too, but if it's okay, I'd like to back up a little bit first and just share that really over the last few years, it's really come to my attention the problematic way in which we talk about disability.
Mm-hmm.
And in terms of my training in college and graduate school was in the medical model, which is, we figure out what's wrong, what are the symptoms, and how do we fix it. And through my own cancer experience and my child's developmental disability diagnosis, I realized these two things should not be in the same camp. It's really problematic because for something like cancer, we really want to figure out exactly what's wrong, identify the symptoms, find a cure, and really fix things. But someone who has a developmental disability, someone who we say is neurodivergent, their brain is wired differently, that is going to be part of who they are. And so to look at it as a problem that needs to be fixed is in itself counterintuitive to a healing process, right? We want to promote understanding and compassion and figure out what supports are needed for that child, that person to function and thrive in their everyday life. For my child, I wanted her to be a kid who loved herself as a kid with ADHD, who could understand herself and her struggles as a kid with ADHD, who could figure out how to thrive as a kid with ADHD. And so I just kind of came to this point where I thought I need to do this differently. I need to do this my own way outside of the medical model and just create a process where it's about learning more about this child, how their brain is wired, better understanding them, so that we can provide the right support. And so with that, I will pull up my slides to share here and just give a little bit more information about neurodiversity and what that means. So when I say neurodiversity, that term encompasses all brains, right? Diversity is all the variations. The term neurodivergent is usually used to describe somebody who has a developmental disability or some kind of difference in how their brain is wired that's, again, changing kind of their experience in the world and their behaviors and their functioning. So some examples are autism, ADHD, learning disabilities, dyslexia being the most common, which has to do with differences in how the brain processes the activities involved in reading, and intellectual disability. I also do a lot of work with giftedness, which is not a developmental disability, but it's kind of the other end of the bell curve, and from intellectual disability in terms of appreciating that there are differences in being a gifted individual in this world and how they process information. And so these things are present from early in life. They're, and change the way that someone functions such that it's usually impairing or causes a lot of distress if they're not properly supported. And so just for an example, this is an fMRI study, so a functional MRI where they put somebody in a scanner and have them do something. And in this case, this is two different brains looking at faces. And one example of a difference in the brain wiring of individuals with autism is that when they're looking at faces, they're not activating the part of the brain that non-autistic people use to evaluate faces. So the brain A on the left there is a non-autistic neurotypical brain. And that small area at the bottom of the brain is called the fusiform face gyrus, and it lights up to scan and interpret faces. Whereas in the autistic brain, B on the right there, you can see those areas aren't lighting up. And what they found actually is that autistic people, when they're looking at pictures in their area of expertise, for example, if they're an expert on different kinds of birds and they can look at any bird and figure out what it is, that fusiform face gyrus area actually will light up for them when they're visually scanning and interpreting something that they're an expert on. And so we kind of learned that actually it's not necessarily that part of brain is related to facial processing, it's related to kind of expertise in assessing kind of visual detail and emotional salience for that information.
So really, what is of importance to that particular person in terms of, whether it's emotions attached to it or their high level of, attraction towards that particular topic, they are more likely to be rather than just in a normal person where it's facial expressions.
Right.
Right.
Yeah. It just really hits home how there are truly different biological processes happening, differences in the wiring that impact how they process.
Yeah, literally how our brains are wired differently.
Yeah. And this is another example with dyslexia. So when a non-dyslexic person learns to read, their brain starts to activate these different areas that have to do with looking at a word and recognizing it, understanding the sounds in that word, understanding the word meaning. So kind of looking at the word and getting a picture in their mind of what it is. So I like to think of it as using 3 different muscles to do this complicated job. Whereas a dyslexic brain tends to rely only on that part, that one muscle that has to do with analyzing a word part by part. And so what happens is a non-dyslexic reader, once they kind of do this visual analysis, sounding out a word, recognizing a word a few different times, then it becomes automatic. Right? When you read, you just see the word, you know what it is. And so like these 3 different regions work together, whereas a dyslexic reader they never get to that point of automaticity, or it takes a lot more work to get there. And so they're constantly going through this process of trying to visually analyze or sound out words and having a really hard time. So that reading is much more effortful. And unfortunately, a lot of the standard ways of teaching reading in schools don't necessarily line up with how their brain learns to read. But the great news is we know exactly how to teach reading to a dyslexic brain so that it can learn to read more efficiently. And we can put those same brains in a scanner and find that, as you can see over on the right, that third picture, children with dyslexia after remediation, now you're seeing those other areas start to light up and work together. So that also hits home as to why it's important to identify neurodivergence, because
Yes.
it's something that, these kids, I see them and sit in my office and they are heartbroken that they can't read. And it comes out in behavior, or it comes out in school avoidance, or it comes out in anxiety. And it's not because they're not intelligent. It has actually nothing to do with intelligence. It's
Yeah.
despite being quite intelligent and despite getting good education, their brain is just not processing that information the same way. So they need a different approach.
Yeah. And you mentioned the bell-shaped curve. So does that mean that all of us fall somewhere on that curve, and it's just that who we talk about as typical or normal, so to say, that's what the system is geared towards, but people can fall anywhere on that curve. Can you tell us a little bit about how
Yeah,
many, like some statistics about how many people fall into the neurodivergent category?
sure. So I'll start by explaining it how I like to explain it to kids sometimes, because a lot of kids I meet play video games, and most people are familiar with Mario Kart.
Yeah.
And so they can understand this idea that the different characters have different stats. So like Bowser might have really good powers, but he's slower to get going, but he can do corners really well, and he can smash other cars or something, so there's kind of every character has different stats where they're kind of weaker or stronger. And I say like our brains are the same way.
Mm-hmm.
And most people have stats that kind of fall in a certain range.
Hmm.
And some people have stats where they're really, really strong in some areas and have a much harder time, or are developing at a slower rate or just differently than other people. And so it's all about understanding your stats, kind of your strengths and your challenges. And so it's not as simple as where does one person fall on a bell curve, because what we're really looking at is a lot of different areas of functioning, a lot of
Yeah.
different skill sets,
Hmm.
and kind of mapping out where do each of those fall on that bell curve for that person.
Right. Yeah.
And
Okay.
understanding that can help us to know, why is this behavior showing up here? Why are they expressing sadness or worry? Why are they complaining about school? Like, it kind of helps you see underneath
Hmm.
what's driving some of those um, behaviors and symptoms that we do want to reduce, right? We don't want kids to be impaired or feel like they're suffering.
Right.
So by knowing what their wiring is, we can adjust
Hmm.
accordingly.
Yeah. No, that's such an important piece of information, because parents generally who haven't studied psychology or who don't have a background to understand this find it really hard when their child is struggling. So people watching this might want to know, so okay, now I have some idea about what is neurodivergence. So how do they find out if their child is neurodivergent? What are some of the ways to find that out, and at what age should parents start looking for signs,
Sure,
if any? Yeah.
that's a great question. I think it's important to start asking questions about if there's something going on kind of in the child's development. If you can see that they are consistently having a hard time despite trying and despite having all these strong skills in other areas. Maybe it's they are just consistently struggling with being in groups of kids and making friendships, or they're consistently struggling or feeling bad about impulsive behaviors, or they're getting a lot of negative feedback from teachers and friends about their behavior, and they're starting to feel bad about it. So those are some signs that that they're doing things differently or experiencing their world differently in a way that's impacting them. And so it's time to ask questions around like what's driving that and how can we understand it so we can support them, so we can develop their skills, provide some accommodations, and just make things go better for them.
Mm-hmm.
Yeah.
So we will go into the actual evaluation and testing, but there's one word that is used, and that word is masking. What is
Mm,
masking when we say a neurodiverse individual is doing masking to cope with some of the things that they are facing? Can you talk a
mhm.
little bit about that?
Yeah, I can tell you how I think about it, and the way I define it might be different from how it's used elsewhere. I think a lot of psychology terms are being appropriated and used very freely in
Mm-hmm.
the TikTok world and things like that. So,
Yeah.
masking, I first heard that term kind of in working with kids with autism. And some kids with autism have enough social awareness to recognize that there are some social expectations for the situation. There seem to be certain ways people act and don't act, but
Mm,
I can't intuitively kind of pick up on that and just go with the flow. It's more of a observing, studying, calculating, adjusting behavior to try to fit in.
mhm,
And that effort that's required in order to kind of blend in is what I think of as masking. So they're compared to someone who's not autistic, they enter that same room of people, they may much more intuitively understand sort of what's expected of them and what behavior is, in terms of conversation and questions to ask and ways to respond.
mm,
Um, they don't necessarily have to effortfully think through that. It just kind of happens. And for the autistic person, it's can be very effortful. And so they're masking, putting on a mask to try to fit in the
mm,
situation.
Yeah, and that can be really stressful.
It tends
Um,
to be very exhausting for them.
yeah,
Yeah, it
yeah,
takes a lot of effort. It kind of drains their batteries, how I've heard it
yeah,
described. Yeah,
yeah. Um, so let's talk about testing and evaluation, because if someone thinks that their child is neurodivergent, or they need to find out how his brain functions. So what are some of the things they do in a clinical setting to
sure.
evaluate? Yeah.
So I like to say the best assessment tool is a good interview because that's really what's going to get you the richest information is talking to parents and asking the right questions and knowing when to dig deeper to learn more about a child's developmental history and what's going on now and what they're seeing at home, and really translating those stories into an understanding of kind of starting to map out where those strengths and weaknesses might be. And in terms of the evaluation process, we always start with a good clinical interview. And then we do some in-person appointments with the child. So our standard process is about 2.5 hours each in-person appointments. And in those meetings, we're getting to know the child, and we're also doing some standardized test measures, meaning these tests were developed and normed on large groups of people. So by doing those kind of assessments with the child, we can say, oh, here's where they fall compared to other kids their age.
Hmm.
And so we're looking at a lot of different areas of development, and we're digging deeper in areas that have to do with the referral questions. So for someone with autism, we're going to be spending more time on things like social communication and kind of maybe flexible thinking skills. They tend to have more difficulties with kind of shifting their thinking, getting stuck on one idea or plan. And whereas with someone with ADHD or a learning disability, we might be spending more time on impulse control and attention. With academic related questions like learning disabilities, we're really looking more closely at reading, writing, or math, depending on what the concerns are and of some of the processing skills involved with those things. So it's similar each time, but it's different each time, depending
Mm-hmm.
on what the questions and concerns are. And then we take that information, we pull it together with what we learned in the clinical interview. We get information and observations from teachers. Sometimes we're calling therapists or other important people in the child's life to get as much information as possible. And then kind of putting that all together and saying, okay, so here's what we've learned. Here's where they're really shining and doing beautifully and right on track. And we can see in these areas they're struggling with A, B, and C. And that really helps us to understand the concerns you're seeing. And that kind of gives us a description and a guide for what to do next. So then we talk about kind of next steps for follow-up.
Yeah. And what age, like how young can a child be before you can, so I'm just trying to figure out, is there a time where generally when they have preschool screening is when, sorry, kindergarten pre-screening is when parents become aware that, oh, my child is behaving differently than other kids his age, or a child as young as 2 years old can also be brought in? Like, what is the age?
Yeah. So actually, neuropsychologists can work with babies. I've seen when I was on my postdoc at the University of Minnesota, there was kids who go there who are born with known genetic syndrome. So we, track their development from very early on. In my current practice, I think the youngest I've seen is about 18 or 20 months because there are indicators of autism that can be apparent that early.
Okay.
I would say most of the time, the kids we see at developmental discoveries are between the ages of 4 and 18.
Okay, yeah. So it looks like it's better if the parents become aware early on so that the child gets help early on before they enter school, and you can provide help.
Yeah, I mean, it's tough though, because sometimes things don't stand out until a later point in development. So sometimes, if you think about like this is the trajectory, or you go in the pediatrician's office and they show you that growth curve. And sometimes what can happen over time is if this is the typical trajectory, the child's trajectory is like this. So the gap doesn't widen, so to speak, until a certain point. And
Okay.
so a lot of times parents are sitting with me in feedback sessions feeling very guilty, like they should have done this sooner, identified it sooner. And I always say, it had to kind of come into the picture like this. Like this is sort of how it had to unfold, because you wouldn't have known to look at it sooner until you're kind of, noticing more things, or the child is having difficulty. If they're doing great, then great. There's really nothing to try
Yeah.
to kind of dig in and understand better. But yeah, it's ideally you can kind of lean in and support them at a point before it becomes really
Yeah.
impairing or distressing.
Because nowadays we also hear about people who get diagnosed as adults, right?
Mm-hmm.
Autism or ADHD as adults, and then also they can get help still. So that's great. So what about treatment? So we get the evaluation done, and now you have a diagnosis. So what are some of the ways treatment is done?
Sure. So I think about it just more as next steps. So when I'm writing my report, the recommendation section is laid out as next steps for school, next steps for clinical follow-up, and some other resources and ideas to incorporate at home. So educationally at school, oftentimes it's recommending that families request accommodations or a 504 plan. So a 504 plan is a set of accommodations, which are really just adjustments to the learning environment so that the student is not at a disadvantage due to a disability. So the way that a student in a wheelchair would need a ramp, you
Right.
would say, work harder to get up those stairs. It's unfair if you get a ramp and no one else does. No one would say that. But for someone with ADHD, for example, instead of a ramp, it might be sitting up near the teacher. It might be taking tests in a separate room where there's less distractions, having some extra time to double check for mistakes, things like that. Or with someone with dyslexia, it's access to some audiobooks when there's more reading required, or it's making sure someone's available, or they have some IT, some tech to do some text to speech for
Yeah.
them. So families can follow up with schools to ask for an accommodation plan. And in some cases, an identified disability like autism, ADHD, or learning disability can really interfere more significantly with their academic progress.
Mm.
So if the student is not, making passing grades, they're needing a lot of extra support in order to get reasonable grades, then they might qualify for the next level, which would be an IEP, an individualized education plan. The idea being the standard structure and curriculum works well enough for most, but if someone has a developmental disability or something else interfering with their access to their education, they need something individualized for them because that standard system isn't working. And so an individualized education plan includes services and accommodations. So services might be reading intervention, it might be some social skills support, it might be study skills support, it might be occupational therapy, speech therapy.
Mm.
So it really depends on
Yeah.
individual.
Mhm.
And then for clinical treatment next steps, again, it's going to really depend on the individual situation, but a lot of times it's things like following up with a therapist so that they can work on better understanding, recognizing, coping with their big emotions, or it may be following up with an occupational therapist to work on daily living skills at home, self-regulation, sensory needs. It might be following up with a speech language pathologist for language development or for social language development, understanding how to use language for the social world.
Mm.
Sometimes it's talk to your doctor because this is a situation where it's reasonable to consider a medication, either for mental health symptoms like anxiety or to help regulate like a child with ADHD who is extremely impulsive or extremely inattentive. And sometimes there's more specific medical follow-up needed, like genetic
Mm.
testing or neurology, depending on the situation. So it's all tailored case
To
by
each
case.
individual child. Yeah,
Yeah.
that's really good information. So, talking from an immigrant perspective, I was just wondering, do you see a lot of immigrant families, like, for example, South Asian families coming in, bringing their child to get evaluated?
I have had a number of families with Korean background, Chinese background, Japanese background. I've had very few from more of the South Asian geographic
Mm-hmm.
area, and I was wondering why that was the case because I live in Plymouth and there's a very rich South Asian community here. A lot of my kids' friends and classmates are South Asian and my neighbors, and I just so I started asking questions when the opportunity arose, and that's how I got connected with you.
Yeah.
Um, so yeah, my understanding is that there's some kind of cultural and religious kind of ways of thinking about some of these things that may cause some hesitation in terms
Right.
of
Yeah.
follow-up.
So in our community, especially, there are parents who always ask if a question comes up that maybe your child needs evaluation, might have a developmental disability. The first question they ask is, is this label going to stay with my child for his or her own whole life? So they're worried
Mm,
about putting that label on the child that, oh, this child is dyslexic or this child has autism. And
mhm.
then, since there's a high emphasis on educational achievement, they are worried that if my child is a special needs child, this child might be, isolated, put out of the normal academic stream, and they don't want that for their child. So it's very hard for a South, in general. I'm not saying all parents, but in general, they might find it really hard to face the fact that their child might have a developmental disability.
Yeah. And I
And
think that's
that's
a very human experience too. I think there's always grief in when things aren't going as you expected, or your vision of the future changes because you have this different piece of information that shifts you're kind of imagining what it's going to be like. And that's understandable.
Yeah,
And at the same time, that child is that child. They're wired how
right.
they're wired, whether we call it something or not. Um, so I can appreciate it from both perspectives. I guess in my experience, kids usually find a way of explaining things to themselves if someone's not explaining it to them.
Hmm.
And so I hear, uh, I'm just not that smart.
Hmm.
I'm, I'm just awkward, or I'm bad. I'm a
Hmm.
bad kid, because they're getting a lot of negative feedback for their behavior. And it's helpful and healing, I think, just to shift in understanding around those things, be able to talk about it from a different perspective. So yeah, especially from the Western medical viewpoint of we're stamping a diagnosis on a kid, and that
Hmm.
says there's something wrong here. Of course, families will respond that way. Like, I guess in
Yeah.
my opinion, that's a big problem with the system in general. And then when you layer those kind of cultural pieces on top of it, it makes sense why they
Yeah.
wouldn't want to go
So
there.
yeah, so one of the reasons to have these conversations that we are having is to create that awareness that no, this label doesn't follow the child throughout their lives. This diagnosis is just to help us understand what kind of treatment in the form of what kind of resources this particular child needs so that they can function and do well and
Mhm.
even thrive. Secondly, this is going to help them not only deal with their day-to-day functioning, but their social development, emotional development. Everything is dependent on this. So it's so important that if you're, it's like, treating any other physical ailment, right? You mentioned cancer in the beginning, or just let's say a child breaks his arm. You're not going to say, oh, I'm not going to take the child to the doctor, right? You are
Mhm.
going to think of fixing the arm. It's same thing with mental health and all these
Yeah, and mental health, yeah. Yep.
developmental issues. So
Mhm.
that's the reason we want more people to just be aware of this. Hope they don't need to do it for their own child, but even if they see someone else's child struggling, they can definitely talk about this.
Sure.
So you said you are in Plymouth, and so if parents or anybody who's listening to us and watching our episode wants to make an appointment or get in touch with your clinic, which is called Developmental Discoveries,
Mhm.
how can they do that? If you want to quickly tell us the website or the email or whatever you want to share.
Sure. So it's Developmental Discoveries, and our website is developmental-discoveries.com. It's just a hyphen in the middle there. And I work with three other wonderful neuropsychologists. So we've got a great team, and we all do the same type of work, the same approach. And you can check out our website to learn more about what we do. I have a Facebook page under Developmental Discoveries, and also an Instagram where I try to
Mhm.
share information and ideas so that it's accessible to everybody, and do some talks for local groups too. I'll probably be at the Autism Society conference this spring, and do local teacher trainings, things like that as well. And I love that
Great.
work too. So if others are interested, I'm happy to come and educate and talk about these things that I love and the kids that I
Yeah.
enjoy working with.
Yeah. Thank you so much, Dr. HelmEn, for spending time with us and talking about this important topic and giving so much useful information. This was really useful. Thank you so much.
Well, thank you. And I'm looking forward to learning more from you tomorrow when you come and train our group of clinicians. I'm really excited
Yes.
about that. So thank
Yes.
you. Thanks for having me.